Hi, my name is Dr. Nana Buachi. I'm a board-certified dermatologist, acne and aesthetic specialist, and I love talking about dermatology and wellness and how it aligns together. May is Skin Cancer Awareness Month, and it's really imperative that we talk about skin cancer, we talk about sun safety tips, and we talk about how skin cancer impacts people of color. So let's talk first about skin cancer. So when it comes to skin cancer, there are three types. We have basal cell skin cancer, we have squamous cell skin cancer, and then we have melanomas. Basal cell skin cancer is very common. It occurs usually on the head and neck region, and that's because of the ultraviolet light. We have also the next common skin cancer is squamous cell skin cancer. Now with squamous cell skin cancers, they can occur in those regions that we just mentioned, the head and neck, but they can also occur in the genital area as well as the hands as well. So again, those can be induced by ultraviolet light, but they can also be induced from maybe inflammatory conditions like lupus, or maybe even a burn or a non-healing ulcer. The next type of skin cancer that we think about, which has a high mortality rate, are melanomas. Melanomas can occur anywhere on the body. So yes, it can occur on sun-exposed areas as well as non-sun exposed areas. In patients of color, melanomas are rare. However, they can occur on the hands as well as the feet, and they tend to have a high mortality rate. In patients of color, basal cell skin cancers can occur in those of Asian descent as well as Hispanics, whereas squamous cells are the more common skin cancer in African American patients. So now let's talk about sun safety tips. So when it comes to sun safety, we always want to make sure that we're wearing sunscreen for one, and sunscreen should be worn every day. Doesn't matter if it's raining, it's snowing, it's hailing outside, sunscreen should be worn all 365 days. And it also should be worn indoors as well. In addition to that, we do recommend wearing wide brim hats when you're going outdoors. You want to make sure you're wearing sunglasses, and also you want to make sure that if you're going to be at the beach or at the pool, or maybe you're going for a hike, consider wearing one of those UPF shirts or UPF gear. I also recommend that you shouldn't do self-exams at home every couple of months, so that when you are familiar with what's on your skin, and if something new pops up, you could go to your dermatologist and tell them, hey, guess what? I have a new growth. This is what it looked like before. This is what it looked like after. So the reason why I'm concerned, doc, is because maybe it's changing size, it's changing shape, it's changing color, or maybe there's an itch, there's a burn to it, it's bleeding. So that way, you know what, if a biopsy is needed, we could go ahead and do that. So I think these are some really interesting tips that we just recommend for everybody. And it's just so imperative that you are familiar with what's on your skin. You take a look at what's on your skin. You see a doctor every year just for them to do a skin check. You're always wearing sunscreen, whether the sunscreen is a chemical sunscreen or a physical sunscreen, doesn't matter. We just want you to wear sunscreen. And just another tip, when you are outdoors, before you go outdoors, put it on 30 minutes prior to going outdoors, and then just make sure you reapply every 2 hours. Remember, it's a teaspoon for your head and neck region. I always call it the peace sign when I'm applying it to my head and neck. So if you found these tips really helpful, please subscribe to my page. Twice a week, we're going to be posting videos on some fun tips in the dermatology and wellness space. I'm Dr. Nana Buachi. I hope this completes you.